and welcome to How to Gastro. In today's video, we'll be speaking about a very important topic, and that is scarlet fever. And if you were able to watch my last video on strep throat, then this video will make a lot more sense. But if you haven't given that video a watch, I do suggest you give that video a watch before you watch this one, because scarlet fever is actually a continuation of the disease from the primary strep throat infection. But without further ado, let's get started on this video of scarlet fever. So what is scarlet fever? Scarlet fever, which is also commonly known as scarlatina, is an infection that may develop in people who have had a strep throat infection. Scarlet fever is characterized by a distinctive bright red rash on the body, which is usually accompanied by a high fever and a sore throat. The same bacteria that causes the strep throat infection, which is the group A streptococcus, also known as the Streptococcus pyogenes bacteria, also causes scarlet fever. So from this definition of scarlet fever, we see that it was a disease that was also commonly referred to as scarlatina, and is actually an infection that develops secondary to the primary strep throat infection. So the strep throat infection is the infection of the pharyngeal area, which includes the tonsils, the uvula, the back of the oropharynx, as well as the tongue. And the specific bacteria that usually causes that strep throat infection is that group A streptococcus bacteria, more specifically Streptococcus pyogenes. So in patients who suffer from scarlet fever, we have a progression of that original strep throat infection to now a distinctive bright red rash which occurs on the body, and usually a very high fever which also develops in these patients in addition to their original sore throat infection. So now that we know what the basics of scarlet fever is, let's take a closer look at how one can contract the disease. So as we mentioned in the slide before, scarlet fever is caused by a toxin released by the bacteria Streptococcus pyogenes, the same organism that causes strep throat. A small percentage of patients with strep throat infections will go on to develop scarlet fever. So as we mentioned before, the same group A Streptococcus bacteria that causes the strep throat will go on to cause the scarlet fever. So now let's take a closer look at some signs and symptoms in patients who have scarlet fever. So scarlet fever usually starts with a sudden fever, which is associated with a sore throat, swollen neck glands, which are lymph nodes in the neck region, a headache, nausea, vomiting, a loss of appetite, and a swollen and red strawberry tongue. So this is actually what that strawberry tongue looks like, the clinical aspect or the typical aspect of what that strawberry tongue looks like. These patients will also have abdominal pain, body aches, and malaise. So the characteristic rash that appears usually occurs 12 to 48 hours after the start of the fever, and the rash usually starts below the ears, neck, chest, armpits, and groin before spreading to the rest of the body over 24 hours. As the skin lesions progress and become more widespread, they start to look like sunburn with goose pimples. The skin may even have a rough sandpaper-like feel. So as we can see here, this is what that typical tiny red spot sandpaper rash actually looks like. And in the body folds, especially in the armpits and the elbows, fragile blood vessels, which are called capillaries, can rupture and cause classic red streaks, which are called pastilla lines. So as we can see, this is actually an elbow of a younger patient suffering from scarlet fever, and we can see these pastilla lines quite clearly, and these actually represent the fragile blood vessels which have ruptured. And the pastilla lines may persist for 1 to 2 days after the generalized rash is gone. So moving on, let's talk a little more about the diagnosis of this disease. So during the physical exam, the doctor will particularly check the condition of the child's tongue, throat, and tonsils. They will also look for enlarged lymph nodes in the neck region and examine the appearance and texture of the rash. So we're going to look for the specific clinical signs of this disease, which is that sandpaper rash, the strawberry tongue, also the enlarged lymph nodes in the neck region, swollen or red throat and tonsils, etc. So if the doctor suspects the child has scarlet fever, they'll likely swab the back of the child's throat to collect a sample of their cells for analysis. This is called a throat swab and is used to create a throat culture. The sample will then be sent to a laboratory to determine whether the group A Streptococcus bacteria are present. And there's also currently a rapid throat swab test that can be performed in office, and this may help identify a group A strep infection while you wait within about 5 minutes. So generally, the typical signs and symptoms of the patient will point us towards a diagnosis of scarlet fever. But if we would like to confirm the infection, we can use a swab to swab the back of the patient's throat and send the sample off to a lab to be tested for the specific type of bacteria, which is known as the group A streptococcus bacteria. So once we find the presence of this bacteria, we'll know that the child definitely has a current scarlet fever infection. The treatment of scarlet fever. So the treatment of scarlet fever normally involves a 10-day course of oral antibiotics, usually penicillin. So the fever will usually go away within 12 to 24 hours of taking the first antibiotic medication, and patients normally recover 4 to 5 days after starting the treatment. So patients who are allergic to penicillin may take erythromycin or another antibiotic instead. And it is also important that the patient drinks plenty of liquids, especially if there is a loss of appetite, because we don't want these patients to go into dehydration. So Tylenol or acetaminophen may be administered to relieve the aches and pains and to reduce their fever, and calamine lotions can help reduce their itching on their sandpaper rash. And that brings us to the end of this video on scarlet fever. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notification so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.